I frankly just married a guy who works hard. It's a gift that people have from God to be able to handle this kind of pressure.
In a connected world.
He is a humble doctor.
There's still so many things, if not most, that require you to be present, in person. And when you have a calling, it calls from just about every corner of the earth. China, Afghanistan, the Ivory Coast in Africa, and here in Plymouth, Indiana. This is the story of two gentlemen who'll tell you that they're fortunate to have found us. And that's the irony. We're the lucky ones. Talented, compassionate physicians who could be anywhere they want to be. But they chose to be here in Plymouth.
It's great to watch them work. They both are able to walk in people's shoes and understand them and what they need, and I would say that is definitely a leader trait of both of them, so definitely are great leaders within our community.
Dr. Brian Piazza and Dr. James Dammon, two surgeons with a lot in common. Both had fathers who were ministers. Both loved this community, loved their work, helping the men, women, and children who live here, have given part of their lives to helping other people across the globe.
Not a day went by without someone coming to our gate and asking to see the doctor about a backache, a neck ache, an abscess. They brought their children, the runny noses, and everyone lives in one room. So if one gets sick, for all of them too. And
Cindy and Jim have volunteered for years at a time in China and the mountains of Afghanistan, bringing healthcare and modern surgical practices to people in some of the most remote and dangerous places on earth.
They came to value him as a resource. The surgeon would get into something he didn't understand or couldn't handle and would ask Jim if he could help, and of course he'd step in and help.
Very Christian, mission-minded person, and that's what he chose to do at the Ivory Coast. I was there with him for a 3-week, for the second time, in this little hospital campus area.
Brian spent time doing medical missionary work, including surgery, on the Ivory Coast in Africa.
And he wore his little white top and his white shorts, and he came back walking across the campground to our cabin, and he said, well, there's a new person in the world. So there was a new baby born.
I think Plymouth is really lucky to have both of them. Patients that come into Marshall County Surgery are going to have a doctor listening to them. Dr. Dammon and Dr. Piazza are those sort of surgeons.
On med-surg, there's this long hallway. Dr. Dammon is just walking down the hallway with this patient, and the nursing staff saw him, and they were all just staring at awe that a surgeon was actually walking his patient down the hallway. The way he treated the patient, I mean, he treated him like it was his dad or his grandpa or something, and that's just who he is. He's a genuinely nice, kind, compassionate person, and he just happens to be a surgeon on top of that.
Having been a general surgeon, having done that, I know what it requires, and when that call comes at 3 o'clock in the morning, it's not about you. It's about someone you may not even know.
I definitely can't tell you what would drive that, but passion. It would have to be passion.
It takes so much of your life. It's something you have to love.
He enjoys making a difference in people's lives.
Just the gratification from helping people.
It's a gift that people have from God, because he knew all along that he can do as much as he could, but the power of life and death lies in our Father's hands in heaven.
There's still so many things that require our presence in the world. And when you're called to care, the calls are predictably unpredictable.
So I had a patient come in, I think it was like 2 in the morning or so, it was in the middle of the night. And the patient had a fatal diagnosis made in ER. We couldn't offer any more medical care, and there was no surgical care for this patient. So I called Jim just to see if he had any thoughts or recommendations for this patient, and he didn't. But instead of going back to bed, he got up out of bed, put on a shirt and tie, put on a white coat, walked in, and saw the patient and the family at bedside, made sure they had a clear understanding of what was going on. And then we all sat and prayed together with the chaplain, the family, and the patient. And right there, just a memorable experience.
The calls are predictably unpredictable. They come any time of the day, any time of the night, from every corner of Plymouth and Marshall County. So thank you. And God bless you, Dr. Dammon and Dr. Piazza, for answering the call to care.